All right, good afternoon, everyone. And thank you for joining us for this media briefing this afternoon to provide you with an update on the N.W.T's response to COVID-19 in the N.W.T. My name is Ali Kincaid, and I'm the manager of Cabinet Communications. I'd like to remind all of our guests here today to please mute your microphones until you are called upon to limit any potential feedback. And a little hint, if you hold down the mute button, that will unmute you, for you to ask your question. Providing remarks with us this afternoon will be Minister of Health and Social Services, Julie Green, Acting Chief Public Health Officer, Dr. André Corriveau, Assistant Deputy Minister of Education and Culture, Shannon Barnett-Aikman, and also joining us to answer questions will be Territorial Medical Director, Dr. AnneMarie Pegg. As usual, following the remarks of our speakers, we'll open the floor to questions. I will run through each media outlet one at a time, and everyone will have the opportunity to ask at least 2 questions to our panel. I will post the order for questions in the chat, and I will go through the order again when we get to that question period. If you don't have a functioning microphone, please type your question in the chat and I'll read it for you. I'm now going to turn it over to Minister Green to deliver her remarks.
Thank you, Ali. Good afternoon, everyone. Tomorrow is National Kids and Vaccines Day. The Department of Health and Social Services is marking the occasion with engaging and relevant new resources for children and their parents. These materials will help explain and reinforce the benefits and importance of COVID-19 vaccines in a way we hope children can relate to. These materials are the latest addition to our health-related resources that speak directly and clearly to Northern audiences, giving local context to vital information and resources as we battle the pandemic. We recently released a video titled Health Professionals Talk, which features N.W.T health professionals discussing the importance of vaccines for children aged 5 to 11. These new resources for children include a video called Kids Talk that features children from across the N.W.T discussing why the vaccine is important to them, a superhero comic book called The Arctic Vaccinator, a great resource for educators, parents, and children. The story follows 2 children and a Northern-inspired superhero on an educational adventure that teaches them how the COVID-19 vaccine works and why it's so important, and an Arctic Vaccinator coloring sheet contest. Children can submit their own colorful version of this new Northern superhero, along with a quote telling us why, in their own words, the vaccine is important to them, and they will have a chance to win a prize. By developing resources that speak directly to Northern kids in formats that are fun and relevant, we're helping children to understand the vital impacts they can have on keeping themselves, their families, and communities safe. Everyone, but especially kids and their parents, can access these new resources online at www.gov.nt.ca/vaccinehero. As we stare down the start of year 3 of this pandemic, it's now more important than ever to remember that we are all in this together. Getting vaccinated is still the best choice you can make to protect yourself, your community, and the territory, and especially those like young children who can't get vaccinated. I'll now turn things over to Dr. André Corriveau for an update on the current COVID-19 situation in the territory. Thank you.
Well, thank you, Minister Green, and hello, everybody. It feels good for me to be back in the Northwest Territories and provide an opportunity for Dr. Candula to take a well-deserved break and enjoy some quality time with her family. Today I'd like to, I don't know, am I still on video? Okay. So today I'd like to provide some updates on things that are happening right now. And the first one is that we have put this afternoon the access to our modeling, the mathematical modeling that we use to inform our decision making. It's this type of modeling translates what we have learned about how COVID infections spread and behavior over the past 2 years, alongside actual infection data in the N.W.T, to provide a simplified representation of what we might expect to see in terms of burden of illness under current conditions over the coming weeks. Modeling is not a crystal ball, so they're not necessarily accurate predictions, but they have inherent limitations to such models that must be kept in mind. Despite all we have learned about COVID-19 in 2 years, there's still some gaps in our knowledge about how it spreads and behaves in different situations and with each new variant. The N.W.T has also a relatively small population with dispersed communities, so small changes that occur in the actual data can have outsized impact on the model projections. The modeling will continue to be updated in a weekly basis to help give people in the N.W.T additional information that they can use to set their own safety nets and plans to stay safe and healthy. I also want to spend a little bit of time talking about the return to school, because we've heard many concerns expressed with regard to the reopening of schools at this time. So I wanted to highlight the thinking behind the public health decision to allow in school. Since the beginning of the pandemic, and we've consistently observed here and elsewhere across the world that children have a much less frequently impacted by severe illness from COVID. And this remains true with the newer Omicron variant and especially among vaccinated young people. On the other hand, there's accumulated evidence now that there are significant adverse effects to children's mental well-being and their social development when we continue to insist that they attend school through remote means and depriving children of the supports that are available in the school environment. From a public health perspective, the benefits of in-school learning now far outweigh the small residual risk associated with COVID-19 infection. Furthermore, schools have over the past year and a half developed and implemented highly effective measures to reduce and minimize the risk of COVID-19 transmission among their students and teachers. We certainly intend to continue responding to instances of COVID-19 spread within classrooms using our public health management plan, but the evidence to date suggests that the great majority of infections in children are acquired within the home or elsewhere in community rather than in the structured classroom environment. For these reasons, our goal is to minimize in-class learning moving forward, and we're working closely with the Department of ECE and our colleagues in the education world to keep moving forward in this regard. I also want to touch on the topic of the term endemic COVID. I think many people will have heard this. There's other provinces that have been talking about how we have to move to an endemic phase, move from pandemic to endemic. I just want to highlight that endemic doesn't mean that COVID no longer negatively impacts our communities. And it doesn't mean that we won't see severe outcomes associated with the infection when it does occur. However, we're facing a challenge of having to learn to live with COVID-19 and to manage personal and community level of risks with less reliance on public health orders. This includes achieving the highest possible level of immunization across all eligible age groups and continuing to protect the most vulnerable in our communities. We will succeed in this by working together and, like the minister said, continuing to support each other. Finally, just a few more words on the vaccine effectiveness itself. The vaccine is safe and effective. I'm sure people have heard this many times before, but it continues to provide an excellent level of protection against severe health outcomes from COVID-19 infections. And the booster dose increases that level of protection against getting an infection, as well as from severe illness if you experience a breakthrough case. So the National Advice Committee on Immunization recently updated the recommendation and upgraded it for children age 5 to 11 to should get the vaccine rather than may receive the vaccine. I think that's an important statement. Many of the children now are eligible for their second dose, and we hope that there will be a strong follow-up to the first dose, because this is the way to protect ourselves and our communities, making sure that people receive a third dose when they're eligible, and for children to complete their primary series of 2 doses. So I'm going to stop here and pass it to Shannon Barnett-Aikman from the department, who was the ADM at the Department of Education, to continue the introductions.
Thank you, Dr. Corriveau. Good afternoon, everyone. I know it's been a week of very mixed emotions as many students return to in-person learning in the territory. As you heard Dr. Corriveau speak to a moment ago, the Office of the Chief Public Health Officer is confident that children in most communities can return to in-person learning safely. And the Department of Education, Culture and Employment continues to work directly with the N.W.T superintendents of education and our various education bodies to support that continued implementation of strong health and safety measures in all of our schools as our children begin to pivot back into the learning environment. We will continue to look to the OCPHO for the latest guidance and recommendations while supporting the learning and well-being of all of our N.W.T students. Again, as Dr. Corriveau mentioned, being in school is important for our children's learning and development. We know that being in person in school provides benefits that are really difficult to replicate, if not impossible to replicate, through a distance learning approach. Those include, very importantly, for a child's learning and development, a whole host of measures that speak to social growth and development, to improved instruction and learning, of course, to a variety of extracurricular activities that are conducive to a safe environment under the current reality. And we know that schools provide benefits beyond that as well. It's a very holistic support model to growth and development for children. We also know that remote learning can be challenging for families and students and staff, and that it's not a model that has been conducive to the best possible learning for all of our children. So all of those factors certainly come into play when we consider pivoting back to an in-person learning environment. It's important to note that our local school boards have the authority to determine when they resume in-person learning. Some district education authorities have shifted to or extended the remote learning, taking into account their local and regional circumstances, of course. And while the OCPHO has advised that we likely will continue to see cases of COVID in schools, ECE is assured that our very strong health and safety measures already in place in our schools and that continue in our classrooms and in our schools will lower the risk of school-based transmissions. That includes measures like daily symptoms checks, classroom bubbling, masking for students and staff alike, enhanced cleaning protocols, and refraining from high-risk activities, things like high-intensity sports and singing and things like that. As Dr. Corriveau explained, the OCPHO developed an algorithm for managing COVID-19 in school settings. And if there are signs of transmission in one or more of classrooms in our schools, public health has very clear protocols in place and next steps that will be communicated to parents and guardians in conjunction with our schools. We do have a strong link of communication between the education system and the health system, and that those communication links will continue to support our go-forward actions while our kids return to school. We're encouraging students, parents, guardians, and staff who have questions or concerns to reach out to their principal or their school board superintendent if the questions are around instruction and learning under the current environment, or certainly to reach out to Protect N.W.T for more COVID-specific inquiries. As we continue to navigate the pandemic together, I do want to express my sincere thanks to all educators and school staff in the N.W.T. Whether you're teaching students in the classroom through online lessons or continuing to put together learning plans for at-home instruction, the work that you're doing is so very important, and we do just want to reiterate that it is keenly recognized. Thank you.
Thank you all, the members of our panel, for your opening remarks today. We'll now move to the question period. Just a reminder to those who are joining us from the media, please let us know who you'd like to direct your question to before you ask it. That way, that person can be best positioned to give you an answer. If you're not sure who to ask your question to, go ahead and ask it, and we'll try to help you direct it to the right person. Again, just reminder, please keep yourself on mute until it is your turn to ask a question. The order for questions today will be Thomas from Médias Ténois, then Mariah from CKLB, then Emily from Cabin Radio, then Avery from CBC, and Ian from Northern News Services. So we'll continue with that. We'll give everyone a question and a follow-up question or a second question, and we'll go through again if we have time. So with that, Thomas, if you're there, do you have a question for us today?
Hi, good afternoon. Can you hear me well?
I can, yes. Please Go ahead.
Thank you very much. I think my question would be to Mr. Corriveau, or correct me if I'm wrong. We haven't heard today about the healthcare system. Would you say the worst is behind us? Are we still concerned about the impact of this outbreak on our health system?
Yeah, maybe I'll pass that to Dr. Pegg, but I'll just give you a few insights of my own, and then ask AnneMarie to complete it. But when you will see, if you haven't seen it yet, when you see the model, we still expect, although we think we've passed the peak of Omicron, we still expect to see a relatively high level of activity until at least mid-February. And because of the volume and the impact it has on people and the workforce, certainly, and the fact also that many of the serious complications of COVID lag behind people get diagnosed, but they don't necessarily get really sick right away. So there's often a 10 to 15 day gap in terms of indicators with regard to hospitalizations and ICU requirements. So that's we certainly expect to continue seeing some high level of activity for the next week or two. So I'll pass it to AnneMarie to complete that.
Thanks, Dr. Corriveau. So as mentioned, the hospitalizations are kind of the last indicator that we see in terms of the impact that the number of infections is having. And certainly we have in hospital now a number of people who have required hospitalization, and a number of those who are in the ICU attempting to recover from their COVID infection. We are also seeing a big impact on our primary care services, emergency services, and as I've mentioned many times before, public health and other services. But those very end user acute care services, such as clinics and health centers and hospitals, are certainly seeing a significant impact. We are seeing an increase in volumes in some of those areas, and we are still seeing impacts on staff who are either sick themselves or who are off because of isolation. So I would say that we're certainly not over the peak in terms of the impact on the healthcare system. I hope that the number of cases continues to go down, but if we are seeing ongoing higher numbers than what we've seen in earlier stages of the pandemic, we can expect to have higher numbers of people accessing acute care services for a number of weeks to come.
Thanks, Dr. Pegg and Dr. Corriveau. Thomas, do you have a second question?
Yes, about the children going back to schools. We heard too that government employees were back to the office. What impact should this have on the infection curve? Do you do you apprehend, do you expect this to have a significant impact in the number of cases in the next few days?
I would say that would be a question. Sorry, go ahead, Dr. Corriveau.
Yeah, merci Thomas pour la question. So this is a good question. Actually, we wouldn't have allowed this to happen if we thought that it would increase the circulation of COVID. We think that similarly to the school, most employers, including the N.W.T, have over the past 2 years learned and implemented some safe practices in the workspace. And also our data still indicates that most clusters develop around gatherings, parties, and within community or households. So that the workplace is not necessarily a very high risk environment for and the fact that our workforce is fully immunized and that we're offering booster doses as well. So that's really what our thinking is in this regard, and that again the benefits of bringing people back to their workplace whenever possible are greater than the risk associated with it.
Merci beaucoup.
Thanks for that. Next on our list is Mariah from CKLB.
Hello, thank you. I think my question is best suited for Minister Julie Green. I'm curious as to when we can expect the public health emergency to be lifted. Are there any triggers, things we're waiting on?
Yeah, thanks for the question. There's planning underway to transfer services that are now being offered by the COVID Secretariat into the Department of Health, so that we have the resources and staff available to continue to manage outbreaks. The end of the public health emergency will not be the end of our management of outbreaks, but it will be the end of public health orders and the COVID Secretariat, which was set up to implement those public health orders. We are expecting to bring the public health emergency to an end this spring. Planning is well underway to make that happen. And so there will be notice and an announcement when we're ready to provide the details of that. But there are some other steps that will be taken along the way. One is the resumption of leisure travel. Dr. Corriveau and Dr. Candola will be considering when it's appropriate to open our borders to leisure travelers. We had considered doing that in December and then decided not to because of the advancement of Omicron variant. So this state that we're in is dynamic, as it has been throughout the last 2 years, and we are definitely entering a transition phase, which we're currently preparing for. Thank you.
Thank you.
Mariah, do you have a second question?
No, that's all for now. Thank you.
Okay. Next, Emily from Cabin Radio.
Hi, yes. I know there have been updates to how information on COVID cases are being provided on the COVID-19 dashboard. We've gotten questions about if more data is going to be provided on deaths or the number of new cases connected to Omicron by age category, as well as hospitalizations by age.
Thanks for that. I think that's a question for Dr. Corriveau.
Yeah, well, in part, there's always a lag between the information we receive and our ability to process it and put it in a format that can be viewed easily and understood easily. So all I can tell you, and I'm just recently arrived, so I'm not maybe 100% up to date, but there's a lot of work that's going on to, yes, improve the information and enhance the information that's available through that platform, and it should become apparent in the weeks to come.
Thanks, Dr. Corriveau. I would say, Emily, just to add, if you have specific questions about the data on the dashboard, you can also follow up with the COVID communications team at the COVID Secretariat as well. But do you have a second question?
Yes, so I know the current public health order is set to expire on January 30th for many communities. I'm wondering if that's currently on track or if there's any consideration if it might be extended.
Dr. Corriveau?
Yeah, well, we're in active discussions in this regard as well. I think the order itself will be sunsetted, but there might be some aspects of it that will continue related to the limits and capacity, and but we certainly seem to be on track to be able to allow some resumption of higher risk physical activity because of, again, the benefits that are associated with some of those sports, and allowing teams to resume with using best practices, and given that we continue to improve our immunization rates. So that's it's going to be announced later this week.
Thanks for that. Next is Avery from CBC.
Hello. My question is for Shannon. I'm hoping that you can speak to some of the metrics that the G&W.T is using to evaluate students' progress. So the last Auditor General report found, that the metrics were not perfectly accurate, and so I'm just curious, how are you tracking children's learning and how they're being affected by the last 2 years of school closures and that loss of in-person class time?
Sure, thank you. I would say it's safe to say that just like jurisdictions around the world and certainly throughout Canada, the G&W.T and the Department of Education, Culture, and Employment are still working to understand the impact of COVID-19 on learning. Right now, our focus is on doing what we can to help schools adapt and continue to respond to that evolving nature of the pandemic here in the territory, while at the same time prioritizing the best possible learning for our JK to 12 students, regardless of whether that's in person or via some remote learning approach. And again, just like in other jurisdictions, we do have some data gaps in assessing the impact of the pandemic on students, given that measurements of attendance and attainment levels were hampered during the last school year, given the pivots back and forth several times between in-person learning and remote learning. But I can say that we do continue to closely monitor the needs of our students using the existing wellness data that we have, referrals for school-based services, and when our kids are in person in class, this is one of those pieces where our schools, this is the nature of business of schools. It's a continuous feedback loop of assessing where children are at in their learning versus where they were previously, what we need to put in place in terms of instructional supports and other types of learning supports to help take them to those next steps, whatever that happens to be for them as individuals, but also for them as cohorts, as groups. And certainly the Department of Education continues to work with the education bodies who work with the schools to ensure that that feedback loop is monitored. And so although we don't have formal data that speaks to this right now, I can certainly confirm that that's certainly on the plates and the minds of our educators and our administrators and our education bodies. And so we do continue to monitor that informally in the meantime.
Right, and just my follow-up would just be, can you give some specific examples of the data that you are informally gathering that we can expect to see in the coming months?
I can't speak to specific data sources at this point. Certainly the regular, again, day-to-day learning and assessment that goes on in the classroom context between teachers and students and the way that's communicated out to families continues to evolve based on the impacts to learning that we see. For example, how long a school or a classroom may have been pivoted to remote learning, and whether that's an online platform or whether that's a paper-based package. that differs from school to school. So unfortunately, at this point, I can't give you specific metrics or measurements, but we can certainly circle back around to that point when we have more information in the future.
Thank you.
Thanks, Shannon. Next, Ian from Northern News Services. He has typed his question in the chat. Here it is. This is for Minister Green. Regarding the program that's being presented to promote vaccination among children, I'm wondering if a similar program has been tried in another jurisdiction and has been shown to improve vaccination rates.
Thanks for that question, Ian. I'm sorry I don't have a response for you, but I will take up the question of whether it's been tried elsewhere, and I'll get back to you. My initial thought is that vaccination for children is new everywhere. So I'm sure other jurisdictions have thought about how to promote it. I think our vaccination rate is on par with other jurisdictions, but could use some significant improvement, which is why we've launched these new resources. But are they available elsewhere? I'll ask the press secretary to get back to you. Thank you.
Thanks, Minister. And Ian's follow-up is for Dr. Corriveau. And it said, Dr. Corriveau, you mentioned the consequences of distance learning for children's social and emotional development. What do we know about the impact of masking in schools for these factors in young children? And how does that inform the N.W.T's policy on masking in schools?
Well, thank you for that question. The literature that I've seen on this issue shows very little impact of masking on kids in terms of social development or interactions. I think kids understand the use of the masks and why they're being recommended. And I haven't seen any literature that would show that it has a negative impact as compared to the absence of the impact that I was talking about was related to the lack of in-person learning and the resources and supports that the school environment can provide to children that they can't get the same way when they try to keep learning from home.
Thanks for that, Dr. Corriveau. I'm going to go back to the top of the list and we'll go through again. This time we'll do one question. So beginning with Thomas from Média Ténois. Thomas, do you have another question?
No, I don't. Thank you.
Nothing. Okay. Mariah from CKLB, anything more?
Hi, thank you so much. This question is probably again best suited for Minister Julie Green. Have we found any challenges at all with the reliability of putting it on the citizen to be responsible for self-reporting? Have we found any challenges with that? And maybe on its effect in the numbers?
I'm sorry, I'm not the right person to ask that question of. I simply don't know. Is this a question that you can answer, Dr. Corriveau?
I can try to answer it. Yes, I think we've had actually a better response talking to Dr. Candola and the team here since I've got here, that the response in terms of self-reporting has been a lot better than even was anticipated, and better than what some other provinces are experiencing in this regard, because we allowed people to phone in the results rather than just putting it online. So we kind of simplified it, and I think people understand the importance of having some good data. So we actually, I think my impression, having worked in other jurisdictions in the past few months too, that the N.W.T data in terms of new cases is probably right now the best anywhere in this country in terms of accuracy and close to the real thing. But I mean, it will probably take longer before we can prove that or demonstrate it in a more studied fashion. But that's certainly our impressions, that we're getting at least a third of our reports now are self-reported, which is really good.
Thanks for that, Dr. Corriveau. Emily from Cabin Radio, do you have another question?
Yes, so I know it's recommended that students in many communities return to in-person learning, but some parents are choosing to continue to keep their children home. What supports are there for parents who want to continue learning from home?
I think that's probably best suited for Shannon.
Yes, thanks, Sally. If a student can't safely attend school for health reasons or temporary isolation requirements, or as a result of any other direction from public health, of course, learning supports can be provided by their school, at-home learning supports. But it's important to distinguish that because educators aren't resourced, our schools aren't resourced to provide both remote learning instruction and in-person learning at the same time. So in those schools where in-person learning has resumed, their time in the classroom requires their full attention and their full supervision. So teachers can't provide for both realities at the same time. That said, recognizing that there's lots of mixed feelings, as I said earlier on the call, around this, and that parents are gauging how best to respond for their own family situation. If a parent does decide to keep their child at home, there's an element of them needing to take on that responsibility for learning support in the short term. Again, just recognizing that teachers can't provide both modalities at the same time. That said, I mean, as an involved parent, I would encourage you to connect with your child's teacher, with the school admin, to better understand how you can do that in your home environment, certainly. Of course, there's always the option as well, and some parents have opted for this. For those who don't intend for their children to return to school at all this year, then they would need to take on the responsibility of homeschooling. And there's parameters for that formal program, because that is a formal program intended for a long-term commitment for the child to be out of the school environment under the homeschooling regulations. And again, you can reach out to your child's school. The principal there can walk you through some of what the parameters around that kind of a program are and what kind of commitments you'd be looking at as a family and as a parent, if that's something you're interested to explore. I might just also take the opportunity to say that I know the return to in-person learning may be stressful for many, for some, but again, just to reiterate, as you've heard repeatedly on the call in different ways today, the CPHO is confident that children can return to in-person learning safely. And I do want to stress that the education bodies and schools have very strong health and safety measures in place. And so for all of those reasons we've already touched on earlier around some of the benefits to that in-person learning experience in the in-person social context. I just want to reiterate that we're doing our level best and utmost to make sure our kids are returned to the safest possible environment that they can. That said, it's definitely a shift, and I recognize that it will take time for students and for families and for teachers, frankly, to be comfortable as we transition into this new reality.
Thanks, Shannon. Avery from CBC, do you have another question?
Yes, thank you so much. My question is, I believe it would be, well, maybe actually I'll let you decide. My question relates to these specific materials and who they target. And my question was, you know, if vaccination rates are low in 5 to 11-year-olds, why is it not parents specifically that are being targeted with this campaign?
Okay.
As opposed to children.
Sure. Thanks for that. I think we'll start with Minister Green on that one.
Yeah, thanks. That's an interesting question. I don't think that parents are being left out, but I think we are trying to make sure that children are well informed about this, and that there may be some momentum from the children to reluctant parents to get vaccinated, that they see the benefits of that. So it's not exclusive of parents, but it's not either or, it's and. So we're also trying to reach the children to see if we can develop some interest among them, to educate them about the importance of being vaccinated, the benefits of being vaccinated, so that they are willing participants in the vaccination campaign aimed at that age group. Thank you.
I just have a really quick follow-up to that, if that's okay. And it's pretty much along the same lines. And I'm just wondering, many teenagers may go out and get tattoos without their parents knowing, or things like this. What's your advice for children and teenagers whose parents don't want them to get vaccinated, but the kids want to get vaccinated? How can they get assistance getting an appointment?
I don't think there is a formal age of consent for vaccination in the N.W.T. So teenagers could make their own choice. They can use the online booking tool. They need to have a healthcare card. If they have a healthcare card, they can make their own appointment to be vaccinated. They have been offering the NTHSSA has been offering clinics in schools, but I'm not sure if they are still doing that. I think that Dr. Pegg may have some useful information to add on this, so I'll ask Allie to call on her, please.
Sure, Dr. Pegg, go ahead, please.
Thanks. Yeah, just building on that with some more specific info. There are some videos available on social media platforms. There's the Kids Talks that we launched, where kids give their opinions and their info and their impression of vaccination. But there is also a video aimed at parents. It was a question and answer where for a number of days we had hoped to do it live, but some technical difficulties prevented it. And so we were able to collect questions from parents and members of various communities, and myself, Dr. Sam Wong, who's the president of the Canadian Pediatric Society and a pediatrician who's been practicing here for over 20 years, along with Dr. N.W.T, who's the Deputy Chief Public Health Officer, were able to answer some of those questions on the video, on a video platform that is still available. And that was much more targeted to parents and caregivers, whereas the Kids Talk and the comics are aimed at kids, with the idea that that'll be a conversation starter. Kids can bring information to their parents, particularly some of the older ones. And if they're expressing an interest or having questions about vaccination, that may be a time for the parents to address those questions within the home, or also potentially make an appointment with a healthcare provider who's able to address the questions of both the parents and the child, but at the initiation of the child. We certainly encourage parents to continue to contact their healthcare providers if they do have questions. Targeting the kids, though, it's just one more way to get the entire population of the Northwest Territories involved in increasing our vaccination rates, and making it, a bit of an enjoyable activity, and so that kids themselves also feel like they're participating in this effort. And it has a spillover effect as well in terms of other childhood vaccinations. We talk about vaccination right now and everyone assumes COVID, but there are other vaccinations that are important as well. And we want kids to have questions about those, and we want parents, if they have questions about those, to ask them. And this is an opportunity to even have a larger conversation about vaccination in general.
Thanks for that, Dr. Pegg. And I'll just reiterate that the links for the videos that Dr. Pegg is talking about there and the resources that Minister Green talked about earlier were sent out in the news release. And if you have questions or you didn't receive those links, please do follow up with the press secretary and we'll make sure we get those to you. Ian, I'm going to ask if you have another question. I don't see anything in the chat. Oh, I do see one. Okay. He says, follow up on the vaccine promotion program. How much did it cost to develop that program? I'm going to put that to Minister Green. I'm not sure there's an answer to that just right now, but I'll put that question to Minister Green for now.
Yeah, I'm sorry, I don't know how much. That's something I can provide to you afterwards. And the question about whether it's going to be translated into the 9 official languages, I don't have an answer to that either, but I can follow up with information directly to you after this news conference.
Thanks for that, Minister. And that was in response to Mariah's question in the chat about the official languages. Okay, we are at 2:45. I'm going to go back to Thomas. Thomas, do you have any further questions?
No, thank you.
Okay, Mariah, anything else?
I'm good, thank you.
You're good. All right, Emily.
I had some calls from a concerned parent who said at their school some teachers aren't, wearing masks, aren't enforcing mask wearing, and they're really concerned about the COVID-19 protocols. I guess, how is the territorial government monitoring that or enforcing that?
Thanks for that, Emily. I'm going to put that question, I think, first to Dr. Corriveau, and perhaps Shannon may have some specific answers related to schools as well, but I think Dr. Corriveau first.
Yeah, I'm not sure I have the right answer because, like I said, I haven't been here very long, but my understanding is that, there is an enforcement team that would respond to complaints or concerns that are raised and inspect, but we would, certainly in the case of a school context, we would work with the Department of Education, and Shannon probably has a little bit more she can add than I can provide at this stage.
Thanks, Dr. Corriveau. Yeah, honestly, if a parent has a concern around any of the health and safety protocols that are intended to be in place at school and that are in place at school, or they're concerned that they may not be in place in school, I would say the very best route to direct that is to the local school principal and administration. They're the point of contact who's going to have the most immediate knowledge of the circumstances at play in that building, in that environment, and can speak to the specific implementation of the various protocols. With regard to masking, though, it is a requirement in all school settings and on school buses, actually, which is worth mentioning. And so it's an expectation. That said, there are exceptions. There are children and possibly adults within any learning environment who may have, medical conditions or other complex situations at play that would feed into a need for them not to wear a mask. When there are situations like that, if it's a student, then certainly the family is involved in a conversation with the relevant school parties, and a discussion is had around what are alternative safety approaches that can be put in place in lieu of masking if there's legitimately not a way for the mask to be worn. And similarly, if there's a legitimate medical context or complex reality facing an adult staff person in a school, those same considerations are had with the school principal. But again, those decisions are made as exemptions and as on a case-by-case basis, recognizing that on the whole, the school community as a whole is expected to be masking. So again, I guess the short answer would be the first point of contact for a parent there would be, in my recommendation, to reach out to the school principal. They're going to have the most immediate information and be able to support you in your request for basically assurance, I assume, that your children, who must also attend that school, are doing so in the safest environment possible.
Thanks for that, Shannon. Avery has put a question in the chat. If there's time, what phone number or point of contact can people ages 5 to 11 or perhaps their older siblings call to get a vaccine without having to ask their parents? I'm going to ask Dr. Pegg if she perhaps has an answer to that question.
Yeah, so as was mentioned earlier in this, we do not have a formal age of consent for vaccination in the Northwest Territories. The determination of whether the person sitting in front of the vaccinator is able to give consent is made at that time after discussion. For example, if a nurse is about to administer a vaccine, that nurse needs to have a reasonable assurance that the person sitting in front of them and listening to the information about the vaccination that they're about to receive is able to understand what the risks and benefits of receiving that vaccine are. Children under the age of 12 generally would not be considered capable of making that decision without the consent of a parent or another legal caregiver. When we say age of consent, as we look at teenagers, as someone mentioned, teenagers get tattoos. Teenagers routinely access sexual health services without the knowledge of their parents or necessarily without the awareness or consent of their parents. And access to those services is made in the same way. The practitioner makes an assessment at the time of the interaction, whether or not this person is capable in the circumstances of making an informed decision. But children who are in the younger ages, so 5 to 11, we would not be providing vaccinations without the consent of a parent or caregiver, just because it's generally a good practice that those children at the younger ages probably wouldn't be able to fully understand all of the risks and benefits of any medical procedure, including vaccination.
Thanks for that, Dr. Pegg. Ian, do you have any further questions? For Minister Green, on a somewhat different topic regarding the COVID outbreak at Stanton Territorial Hospital in the first week of January, where we learned that data on the number of infected or exposed workers was not shared with the union representing workers at the hospital. Why is this? I.e. Local 11 of the union. That's the question from Ian. If you'd like me to read it again, I can.
Yeah, I'm not sure because the primary relationship between the union and the workforce is handled by the Department of Finance. They have the HR component. I'm not sure what the protocol is for notifying the union of that kind of information. We're generally very careful, or we try to be very careful about sharing health information outside of the people with whom it's necessary to share it. So I'm sorry. Once again, I don't have a really compelling answer for you. That would really be a Department of Finance call about what information is shared with the union about the workforce in any location, whether that's Stanton or the Department of Infrastructure or anything else. Thank you.
All right. Thanks for that, Minister Green. With that, I think we will, we're getting close to the top of the hour here. So I will call a close to our question period, and I will remind media that if you have further questions, please don't hesitate to reach out to the Office of the Press Secretary or directly to the COVID Secretariat with those questions. Also, with regards to the announcement of the various resources today, you can also reach out to the Department of Health and Social Services if you have specific questions on those resources and their availability. I would like to thank our participants today, Minister Julie Green, Dr. André Corriveau, Dr. AnneMarie Pegg, and ABM Barnett-Aikman. Thank you very much for joining us today and for your very thoughtful answers. And I would thank the media for joining us and wish you all a pleasant rest of your day. Thanks again.